It's 6:15 p.m. on October 15th. A woman stands alone in a cold hospital hallway, her designer heels clicking against the sterile floor. Her name is Nia Blackwell, and she's about to make one phone call that will bring a $200 million medical center to its knees. In exactly 5 hours and 32 minutes, Metro General Medical Center will be in complete lockdown. Ambulances turned away. Emergency doors sealed shut. All because they made one fatal mistake. They underestimated a black mother's power. Hey everyone, before we jump into this incredible story, drop a comment and let me know where you're watching from right now. Trust me, you're going to want to buckle up for this one. Now, who is Nia Blackwell? She's the CEO of Meridian Health Solutions, a $2.3 billion healthcare empire that she built from absolutely nothing. Forbes has her on their covers. Harvard writes about her strategies. She commands boardrooms across 3 continents and employs over 15,000 people worldwide. But right now, none of that matters. Because behind those hospital doors, her 16-year-old son Darius is fighting for his life, and the doctors refuse to help him. You see, Nia started as a single mother working double shifts as a medical technician. She knows what it's like to be overlooked, dismissed, treated like you don't matter. She climbed her way to the top of one of the most powerful industries in America. She thought that success would protect her family. She was wrong. Today, all her wealth, all her influence, all her knowledge means nothing. Because when racism rears its ugly head in America's hospitals, it doesn't care about your bank account. It doesn't care about your achievements. It sees one thing, the color of your skin. But here's what Metro General Medical Center didn't know about Nia Blackwell. She didn't just build a healthcare company. She learned every law, every regulation, every loophole in the system. And when they denied her son the care he desperately needed, they handed her the perfect weapon. One phone call. That's all it took. In the next few minutes, you're going to witness how a mother's love combined with insider knowledge can bring down an entire hospital system. This is a story about justice, power, and what happens when the wrong person gets pushed too far. This is the story of how Nia Blackwell shut down a hospital with just one call. To understand the power of what's about to happen, you need to know exactly who Nia Blackwell really is. At 45 years old, she's one of the most powerful women in American healthcare. Time magazine called her the healthcare disruptor. The Wall Street Journal featured her on their front page 3 times. When she speaks at conferences, Fortune 500 CEOs take notes. Her company, Meridian Health Solutions, doesn't just make money, it saves lives. They've developed cutting-edge technology that hospitals across America use every single day. She's got contracts with Mayo Clinic, Johns Hopkins, Cleveland Clinic. Her innovations have treated over 2 million patients. But here's the crazy part. Just 20 years ago, she was a broke single mother cleaning hospital floors at night while studying for her medical technology degree during the day. She knows what it feels like to be invisible in these same hallways where she now commands respect. Her son Darius is everything to her. He's 16, honor roll student, plays basketball, dreams of becoming a doctor just like his mom always encouraged him to be. But Darius was born with sickle cell disease, a condition that turns your own blood cells into weapons against your body. Now here's where Nia's story gets really interesting. She doesn't just know sickle cell disease as a scared mother. She knows it as one of the world's leading experts. Her company spent $50 million developing revolutionary pain management protocols specifically for sickle cell patients. She's read every study, knows every statistic, understands every treatment better than most doctors. And those statistics? They keep her up at night. Black patients with sickle cell disease wait 60% longer for pain medication in emergency rooms. They're 22% less likely to receive adequate treatment compared to white patients with the same condition. 63% of nurses believe sickle cell patients are just drug addicts looking for their next fix. Nia has spent years fighting these numbers through her company's research, through policy changes, through million-dollar donations to medical schools. She thought she was making progress. She thought her success could shield her family from these ugly truths. But today, October 15th, all those statistics are about to become her personal nightmare. You see, Nia deliberately drives 40 minutes past Metro General Medical Center to take Darius to UCSF's specialized sickle cell center whenever he needs care. She knows Metro General's reputation. She's heard the whispers from other parents in support groups. But when your child is screaming in agony, you don't have the luxury of driving across town. Today, proximity trumps everything else. If you're ready to see how one phone call from this powerhouse CEO completely destroyed a hospital's operation, smash that like button right now. Because what happens next will shock you. What Nia doesn't know yet is that in the next few hours, she's about to become the living proof of every horrible statistic she's ever read about. But unlike other parents who suffer in silence, she has something they don't: the knowledge and connections to fight back. 2 p.m., October 15th. Nia is in the middle of a board meeting when her phone buzzes. She sees Roosevelt High School on the caller ID and her heart stops. No parent ever wants to get that call. Ms. Blackwell, this is Nurse Martinez from Roosevelt High. Darius is in my office and he's in really bad shape. Through the phone, she can hear him in the background, low, agonized moans that every sickle cell parent knows too well. It's the sound of his own blood betraying him. I'm on my way, Nia says, already grabbing her keys. 2:15 p.m. She finds Darius curled up on the nurse's office cot, his school uniform soaked in sweat. His usual bright smile is gone, replaced by that glassy-eyed stare she's seen too many times before. When sickle cell strikes, it's like broken glass flowing through his veins. Mom, he whispers, barely able to form the words. It's bad this time. Really bad. Nurse Martinez checks his oxygen levels with the school's pulse oximeter. It reads 94%, technically normal. But Nia knows something most people don't. There's a major problem with these devices that could cost her son his life. In 2020, a groundbreaking study in the New England Journal of Medicine revealed a shocking truth. Pulse oximeters are 3 times more likely to miss dangerously low oxygen levels in Black patients. The devices were never properly tested on darker skin tones, creating a hidden bias that has killed thousands of people. Nia stares at that 94% reading, knowing it could actually be much lower. Her son could be suffocating, and the machine would never tell them. Call 911. Now, she orders. 2:47 p.m. The ambulance screams through Oakland traffic toward Metro General Medical Center. Nia holds Darius's hand as his blood pressure climbs to 165/105. His body's desperate attempt to push blood through vessels blocked by crescent-shaped cells. This is the hospital she's avoided for 3 years. She's heard the horror stories from other sickle cell families. The long waits. The dismissive doctors. The assumption that every Black teenager with pain is just looking for drugs. But right now, it's the closest facility. Her mind races between 2 different modes. The terrified mother watching her child suffer, and the healthcare CEO who knows exactly what should happen next. He needs 4 fluids immediately to prevent his blood from thickening. He needs strong pain medication, not TYLENOL, not ibuprofen, but real opioids. He needs oxygen therapy and careful monitoring for acute chest syndrome, a complication that can kill within hours. She knows the protocols because her company wrote them. Darius is wheeled through the automatic doors on a stretcher, Nia running alongside. The emergency department is busy, typical for a Tuesday afternoon. She watches the triage nurse barely look up as they assign Darius to bed 7. 20 feet away, Dr. Patricia Henley finishes with another patient and glances at the new arrival. She sees a teenage Black male writhing on a stretcher, and her mind immediately jumps to conclusions she's formed over 20 years of emergency medicine. Another one, she thinks. Probably looking for drugs. Dr. Henley has treated hundreds of sickle cell patients, and in her experience, most of them are frequent flyers who know exactly what to say to get opioids. She's tired of being manipulated. She's tired of young black men coming and claiming 10 out of 10 pain when they're clearly exaggerating. She doesn't know that Darius hasn't been to an emergency room in 8 months. She doesn't know that his mother is one of the most powerful people in healthcare. She doesn't know that her preconceived notions are about to destroy her career. All she sees is another case she needs to handle carefully to avoid being fooled. The collision course is set. Dr. Patricia Henley walks into Darius's room with her mind already made up. She's a 20-year emergency medicine veteran who prides herself on not being fooled by drug seekers. She barely glances at Darius before looking at his chart. Sickle cell disease, she says, her voice already carrying that tone. How many times have you been to the ER this year for this? Nia steps forward. This is actually his first crisis in 8 months. He manages his condition very well with, "Ma'am, I need to hear from the patient." Dr. Henley cuts her off without even looking at her. She turns to Darius, who's pale, sweating, and struggling to breathe. On a scale of 1 to 10, what's your pain level? 9, maybe 10, Darius gasps, his voice barely a whisper. Dr. Henley makes a note, but Nia catches the eye roll. She's seen that look before, the look that says, "Sure it is, kid." We see a lot of drug-seeking behavior with sickle cell patients. Dr. Henley announces loudly enough for other staff to hear. "I'm going to start you with some TYLENOL and see how you respond." The words hit Nia like a slap. TYLENOL. For a sickle cell crisis. It's like offering a bandage for a heart attack. "Doctor, my son needs 4 fluids immediately. His blood is thickening as we speak. He needs strong pain management and oxygen therapy. This is a legitimate medical emergency. Ma'am, I've been practicing emergency medicine for 2 decades. I think I know how to treat pain." Dr. Henley's irritation is obvious now. We'll start conservative and see how he does. Brenda, the nurse assigned to their room, catches Nia's eye and shakes her head slightly. She's been here 12 years. She's seen this movie before. Young black men with sickle cell being treated like criminals instead of patients. 3:45 p.m. An hour passes. Darius has received 800 milligrams of ibuprofen, basically strong Advil, for pain that he rates as a 10 out of 10. Nia watches his blood pressure climb from 140/90 to 155/98. His heart rate jumps to 115 beats per minute. She knows these numbers. She's studied them in research papers for years. His body is going into crisis mode, and they're giving him over-the-counter medication. "Doctor, look at his vital signs. His blood pressure is rising. His heart rate is climbing. These are clear indicators that his pain is not controlled." Dr. Henley glances at the monitor. Vital signs can be elevated for many reasons. Anxiety, for instance. There it is. The word that every black patient fears hearing in an emergency room. Anxiety. The medical code word for "you're making this up." 4:30 p.m. Darius starts shivering despite his fever of 100.8 degrees. Nia knows this combination is dangerous. It could mean his organs are beginning to shut down from lack of oxygen. She requests a chest x-ray. Dr. Henley reluctantly agrees. But when the results show early signs of acute chest syndrome, a potentially fatal complication, she dismisses the findings. Could be pneumonia. Could be anything really. Nia stares at the x-ray. She's not a radiologist, but her company has funded enough sickle cell research for her to recognize the telltale signs. Those cloudy areas in his lungs? That's his blood cells clumping together, blocking oxygen flow. 5:15 p.m. 3 hours in, and Darius has received 1 liter of 4 fluid, about half of what the standard protocol requires. No oxygen therapy. No adequate pain medication. His oxygen saturation on the monitor reads 91%, but Nia knows it could be even lower due to the pulse oximeter bias. She watches her son, this bright, funny kid who wants to be a doctor someday, reduced to whimpering on a hospital bed while medical professionals treat him like a drug addict. The statistics she's read in boardrooms are now playing out in real time. Black patients waiting longer, getting less medication, being dismissed and degraded. Her son has become another data point in America's healthcare inequality crisis. 5:30 p.m. Darius's breathing becomes labored. His fever spikes to 101.2 degrees. He's developing the exact complication Nia feared most, acute chest syndrome. Without immediate treatment, this could kill him. She demands action. Dr. Henley finally returns to the room, looks at Darius struggling to breathe, and delivers the line that will end her career. It's probably just anxiety. These kids sometimes hyperventilate when they're not getting the drugs they want. That's it. That's the moment Nia Blackwell transforms from desperate mother to avenging force of nature. Drop a comment right now and let me know, have you or someone you love ever experienced medical bias like this? Share this video to help raise awareness about what's happening in hospitals across America every single day. The next phone call Nia makes will change everything. Something shifts in Nia Blackwell's eyes. The desperate mother who's been begging for help for 3 hours is gone. In her place stands the CEO who built a $2.3 billion empire by being smarter, tougher, and more prepared than everyone else in the room. She pulls out her phone and starts taking photos. Every machine, every monitor, every reading. Click. Darius's admission bracelet showing 2:47 p.m. Click. The blood pressure monitor displaying 165/105. Click. The oxygen saturation reading of 91%. Click. The nearly empty 4 bag that should have been replaced an hour ago. Nurse Brenda watches her with growing respect. She's seen plenty of parents lose their minds in situations like this. But this woman? She's building a case. Nia opens her notes app and starts typing with the speed and precision of someone who's spent 20 years in corporate warfare. 3:10 p.m. Dr. Henley assumes drug-seeking behavior before examination. 3:45 p.m. Inadequate pain management protocol. 4:30 p.m. Chest X-ray findings dismissed. 5:30 p.m. Acute chest syndrome symptoms ignored. The legal weapons. You see, most parents in this situation would be helpless. They'd complain to patient services, maybe write a bad review online, possibly hire a lawyer months later when the trauma has already been done. But Nia isn't most parents. She knows something Dr. Henley clearly doesn't. Metro General Medical Center is violating federal law right now, in real time. It's called EMTALA, the Emergency Medical Treatment and Labor Act. Here's what it means in simple terms. Every hospital that accepts Medicare funding, which is basically every hospital in America, must provide appropriate medical screening and stabilizing treatment to anyone who walks through their emergency doors. Period. No exceptions. They can't delay treatment to ask about insurance. They can't provide substandard care based on assumptions about drug seeking. They can't discharge a patient with an emergency medical condition without stabilizing them first. Every single thing Dr. Henley has done in the past 3 hours is a direct violation of federal law, and Nia has documented every second of it. The network. But here's what makes Nia truly dangerous. She's not just any parent with a smartphone. She sits on medical boards with state health officials. She has the personal cell phone numbers of regulators. She knows exactly who to call and what words will make them act immediately. Her company has government contracts worth hundreds of millions. She's testified before Congress on healthcare policy. She's been to White House meetings on medical innovation. When Nia Blackwell calls state health authorities and says there's an EMTALA violation happening right now, they don't put her on hold. The decision point. At 5:45 p.m., she makes her choice. Darius is getting worse, not better. His fever is rising. His oxygen levels are dropping. His pain is still at a 10, and they're still giving him children's TYLENOL for a medical emergency that could kill him. She steps outside treatment room 7 and sees the bustling emergency department. Doctors rushing to help other patients. Nurses providing real medication to people who need it. Everyone getting the care her son is being denied. The system isn't broken. It's working exactly as designed. It just isn't designed to work for people who look like her son. That ends tonight. Hit that subscribe button right now because what happens in the next few minutes will completely blow your mind. You will not believe how fast justice can move when the right person makes the right call. Nia walks toward the hospital corridor, phone in hand, about to unleash 20 years of knowledge, connections, and pure determination on a hospital that picked the wrong family to mess with. Nia steps away from the chaos of the emergency department into a quiet hallway. Her phone shows dozens of missed calls from her office, but right now, only one number matters. She scrolls to Dr. Michelle Torres, CA Department of Health, and hits dial. It rings twice. Michelle, it's Nia Blackwell. The voice on the other end immediately shifts to attention. Dr. Michelle Torres, Deputy Director of the California Department of Public Health, knows that name well. They've worked together on 3 major healthcare initiatives. They've shared stages at medical conferences. When Nia Blackwell calls, it's never for small talk. Nia, what's going on? I'm calling to report an EMTALA violation in progress at Metro General Medical Center in Oakland. Multiple violations, actually. Dr. Torres sits up in her office chair. EMTALA violations are serious business, but when they're reported by someone of Nia's caliber, they become priority 1 emergencies. You have to understand. This isn't some random parent calling to complain. This is Nia Blackwell, the woman who helped California redesign their Medicaid technology systems. The CEO who testified before the state Senate on healthcare access. The leader whose company has saved the state millions in healthcare costs. When Nia speaks, people in power listen. Walk me through it, Dr. Torres says, already reaching for her emergency contact list. Nia's voice becomes laser-focused, delivering her report with the precision of a surgeon. My 16-year-old son presented with sickle cell crisis at 2:47 p.m. Classic vaso-occlusive presentation, severe pain, elevated vitals, fever development. Instead of following standard protocols, the attending physician immediately assumed drug-seeking behavior and has provided grossly inadequate treatment for over 3 hours. She doesn't pause, doesn't get emotional. Pure clinical facts. He's received 800 milligrams of ibuprofen for 10 out of 10 pain. 1 liter of 4 fluid instead of the required aggressive hydration. No oxygen therapy despite declining saturation levels. Chest X-ray showing early acute chest syndrome completely dismissed. The physician told me his breathing difficulties are probably just anxiety. Dr. Torres is already typing notes. Jesus, Nia. Michelle, they've violated every EMTALA requirement. No appropriate medical screening. No stabilizing treatment. And I have documented evidence of every violation. Timestamps, photos, recorded vital signs. This is happening right now, and my son's condition is deteriorating. If he suffers permanent organ damage or dies because of this negligence, Nia continues, her voice dropping to steel, I will ensure Metro General never treats another patient. I have the resources, the connections, and the evidence to make that happen. Dr. Torres has known Nia for 5 years. She's never heard her make a threat she couldn't back up. Immediate jeopardy. I'm classifying this as immediate jeopardy, Dr. Torres says, and those 3 words carry devastating power. Immediate jeopardy means patients are at risk of serious harm or death due to the hospital's actions. It's the nuclear option in healthcare regulation. When a facility is declared immediate jeopardy, Regulators can act within hours instead of weeks. We'll have surveyors there within 2 hours. Full investigation team. Thank you, Nia says. And Michelle? They have no idea what's about to hit them. 2 hours later, Dr. Robert Kim leads a team of 3 state health department surveyors through Metro General's front doors. They're armed with Nia's documentation and the authority to shut down operations if necessary. The hospital's response is immediate and panicked. Suddenly, Darius has a new doctor, Dr. Ana Martinez, who takes one look at his condition and orders for morphine, aggressive fluid therapy, and supplemental oxygen. Funny how quickly proper medical care appears when investigators are watching. Hospital CEO Dr. Margaret Walsh is sound asleep when her phone explodes with calls. Chief Medical Officer, Director of Quality, Head of Legal, all saying the same thing. We have state surveyors here investigating EMTALA violations. They're talking about immediate jeopardy. They're talking about shutting us down. Dr. Walsh sits up in bed, instantly awake. In 25 years of hospital administration, she's never faced an immediate jeopardy finding. Who filed the complaint? Nia Blackwell. The name hits her like cold water. Everyone in California healthcare knows that name. We're in trouble, she whispers. 8:30 p.m., the investigation deepens. Dr. Robert Kim and his team aren't just investigating Darius's case. They're conducting a full emergency department audit. What they find is worse than anyone expected. In the past 6 months, Metro General has treated 47 Black patients with sickle cell disease. The patterns are damning. Average wait time for pain medication is 89 minutes compared to 34 minutes for white patients with similar conditions. Black patients received opioid pain relief in only 23% of cases, while white patients received it 67% of the time. The medical records tell a story of systematic bias. Terms like frequent flyer, drug-seeking behavior, and anxiety appear in 78% of Black sickle cell patient files. The same terms appear in only 12% of white patient files with identical symptoms. Dr. Kim interviews Nurse Brenda, who's been waiting 15 years to tell someone in authority what she's witnessed. Doctor, I've seen kids screaming in pain get TYLENOL while adults with minor injuries get morphine. The difference? The color of their skin. I've written reports, filed complaints internally. Nothing changes. Dr. Kim calls Dr. Torres from Metro General's parking lot. His voice is grim. Michelle, we have confirmed immediate jeopardy. This isn't just about the Blackwell case. We've documented systematic violations affecting dozens of patients. The bias is institutional, not individual. Dr. Torres doesn't hesitate. Recommend emergency suspension? Immediately. They're putting lives at risk every day they operate. In her Sacramento office, Dr. Torres opens the Emergency Powers section of California Health Code. She's only used these powers twice in her career. Both times, people had died due to hospital negligence. Tonight, she's acting before someone dies. Dr. Torres signs the emergency suspension order with a digital signature that seals Metro General's fate. Metro General Medical Center Emergency Department operations are hereby suspended effective immediately due to confirmed violations of EMTALA requirements and immediate jeopardy to patient safety. The facility shall not accept emergency patients until corrective actions are approved by the California Department of Public Health. The order is transmitted electronically to Metro General, the county EMS dispatch, and every ambulance service in the region. The effect is instant and devastating. Emergency room charge nurse David Martinez receives the automated alert on his computer screen. He reads it twice, unable to believe what he's seeing. In 30 years of nursing, he's never seen an entire ER shut down in real time. Attention, all staff. His voice echoes through the emergency department. We are now on complete emergency diversion. No new patients. Discharge or transfer all current patients immediately. The busiest emergency department in Oakland goes silent. Ambulance dispatch radios crackle across the county. Metro General is closed to emergency traffic. Divert all units to Highland Hospital or UCSF. Paramedic units already en route get redirected mid-trip, adding 20-minute delays to critical cases. The ripple effect hits every hospital in the region as they absorb Metro General's usual 200 daily emergency patients. By 1 a.m., hospital CEO Dr. Walsh is in her office, staring at numbers that make her sick. The emergency department generates $50 million in annual revenue, nearly 30% of the hospital's total income. With 127 patients currently admitted through the ER, the shutdown threatens the entire operation. Her phone hasn't stopped ringing. Board members demanding answers. Department heads asking about layoffs. The hospital's largest creditor wanting to know if they can make next month's loan payment. One phone call from Nia Blackwell has brought a $200 million medical center to its knees in less than 6 hours. What do you think? Did the punishment fit the crime? Drop a comment and let me know if you believe shutting down an entire hospital was justified or if it was too extreme. Share this video to start the conversation about how we hold hospitals accountable. October 16th, 6 a.m., the story explodes. By morning, the news has broken everywhere. State shuts down hospital ER after CEO's son denied treatment, dominates headlines across California. Within hours, it jumps to national news. CNN picks up the story by 9 a.m. Fox News runs it during their midday broadcast. By evening, it's trending on every social media platform with hashtags like #HealthcareEquity and #OneCallJustice. The video footage of Darius being wheeled into Metro General, contrasted with images of the shuttered emergency department just hours later, becomes the defining visual of healthcare inequality in America. Social media explodes with thousands of similar stories. Black parents sharing their own experiences of medical bias, discrimination, and dismissed pain. But this time is different. This time, there were consequences. Metro General's crisis deepens by the hour. The emergency department shutdown costs them $137,000 in lost revenue per day. But that's just the beginning. The Centers for Medicare and Medicaid Services launches their own investigation, threatening to terminate the hospital's provider agreement. If that happens, they lose access to Medicare and Medicaid patients, 64% of their revenue base. Their largest insurance contracts come up for renewal in 6 months. Every major insurer is now questioning whether Metro General can provide adequate care. Their medical malpractice insurance carrier raises premiums by 340%. Stock prices for the hospital's parent company crash 23% in 2 days. The board of directors calls an emergency meeting. 3 days after the shutdown, Dr. Patricia Henley submits her resignation letter. 20 years of emergency medicine experience, ended by 3 hours of bias and poor judgment. She doesn't contest the findings. She doesn't fight the sanctions. She quietly disappears from Oakland's medical community. But her departure doesn't solve Metro General's problems. The state requires a complete overhaul of their emergency protocols before they can reopen. The hospital settles with the Blackwell family for $2.8 million, but the real cost is in the mandated changes. Every emergency department employee must complete 40 hours of bias training. New triage protocols eliminate subjective judgment calls about pain. Real-time monitoring systems track treatment differences by race. External oversight for all sickle cell disease cases for 2 years. From trauma to transformation. But Nia doesn't stop with winning her case. 3 months later, she announces the creation of the Blackwell Foundation for Healthcare Equity, seeded with $25 million of her own money. The foundation's first initiative, establishing specialized sickle cell treatment centers in 5 underserved communities. Each center is staffed with doctors trained specifically in recognizing and treating sickle cell crises without bias. Her second initiative hits even harder: a national database tracking emergency department treatment patterns by race. Hospitals can't hide their bias when the data is public. Within a year, the Metro General case becomes required reading in medical schools across the country. Harvard Medical School uses it to teach about EMTALA violations. Johns Hopkins includes it in their curriculum about implicit bias in healthcare. The case reshapes how state health departments respond to discrimination complaints. The 2-hour response time becomes the new standard nationwide. Dr. Torres uses the case to train regulators across America. This is what happens when you have documented evidence of systematic bias. This is how fast we can act when we choose to. Most importantly, the case changes how Black families approach emergency care. They know now that documentation matters, that knowing your rights matters, that sometimes one phone call from the right person can shut down an entire hospital. Nia Blackwell didn't just save her son that night. She changed the entire system for every family who would walk through those doors after them. 6 months after that horrible night at Metro General, Darius Blackwell is thriving. His sickle cell disease is well managed, his grades are back to straight A's, and he's been accepted to Stanford's pre-med program with early admission. But the psychological scars run deeper than the physical ones. He still gets anxious walking into hospitals. He still remembers the feeling of being treated like a criminal while his body was breaking down. That experience changed him in ways that go far beyond his medical condition. "I want to be an emergency room doctor," he tells his mom one evening. "Not despite what happened, but because of it. I want to make sure no other kid goes through what I did." The trauma became his purpose. The discrimination became his motivation. Sometimes the worst experiences create the most powerful advocates. Nia's story reveals something most successful Black Americans don't want to admit. All the money, education, and power in the world can't completely shield you from racism. It doesn't matter if you're worth $100 million or living paycheck to paycheck. When you walk into that hospital room, some people only see your skin color. But here's the difference. Success gives you weapons that others don't have. Knowledge of the system, connections to power, resources to fight back, the ability to document everything and know exactly who to call. Most Black families facing medical discrimination suffer in silence. They file complaints that disappear into bureaucratic black holes. They get lawyer referrals that lead nowhere. They accept substandard treatment because they don't know they have other options. Nia had other options, and she used every single one of them. The Metro General case sent shockwaves through hospital boardrooms across America. Medical executives suddenly realized that their discrimination policies weren't just morally wrong, they were financially deadly. Hospital CEOs started asking uncomfortable questions. How do we treat Black patients in our ER? What would happen if someone with Nia Blackwell's resources filed a complaint about us? Could we survive a 6-hour shutdown? The smart hospitals started changing policies before they got caught. The stubborn ones learned the hard way when other families, inspired by Nia's success, started fighting back with better documentation and legal representation. Healthcare discrimination became a business risk that boards could no longer ignore. Yes, Nia shut down a hospital with one phone call. Yes, she got justice for her son. But the real victory happened in the months and years that followed. The Blackwell Foundation has funded 17 specialized sickle cell centers across America. Each one saves hundreds of Black lives every year by providing bias-free emergency care. The national database tracking treatment disparities has forced over 200 hospitals to change their protocols. When your discrimination statistics are public, change happens fast. Medical schools now teach the Metro General case as a requirement, not an elective. Future doctors learn about implicit bias not as theory, but as a career-ending liability. Thousands of families now know their rights, document their treatment, and demand accountability. The system is changing because people are fighting back with knowledge and preparation. But here's the part that should make us all angry. It took someone like Nia Blackwell to make this happen. It took a billionaire CEO with regulatory knowledge and political connections to get basic medical care for a sick teenager. What about all the families who don't have those resources? What about the single mothers working 3 jobs who can't document every medical interaction? What about the families who don't know Dr. Torres's phone number? They're still fighting the same battles Nia fought, but without the same weapons. They're still watching their children suffer from the same discrimination, but without the power to shut down hospitals with one phone call. The real tragedy isn't that Metro General discriminated against Darius. The real tragedy is that it took someone of Nia's stature to make the system respond the way it should respond for every patient, regardless of their bank account or connections. Your turn to act. If this story opened your eyes to healthcare inequality in America, I need you to do 3 things right now. First, smash that like button to help this story reach more people. Second, share this video with everyone you know, because awareness leads to change. Third, hit that subscribe button and ring the notification bell because I'm bringing you more stories about justice, equality, and what happens when people fight back against discrimination. Drop a comment and tell me, what can we do to make sure every family has the same power Nia had? How do we fix a system that requires wealth and connections to get basic human dignity? Because until every Black child gets the same care Darius finally received, our work isn't done.